My name is Dr. Thomas Kauffman. I am a general dentist in downtown Atlanta. I've been practicing since 1975. Well, let me talk a little bit about how I even heard about InnerView. I was attending a major meeting, and during the course of that 4-day meeting, which had some of the best dentists in the world actually, I heard 4 of these speakers mention this technology. And it fascinated me. Up until InnerView, we've really only had visual data to be able to tell us when we had a problem or not. Of course, we can periodontal probe around the tooth, things of that nature. There are other ways to clinically assess the health of an implant. But this brings to the table a totally different set of data that allows us to know, could we be dealing with the loose screw? Could we be dealing with a crown on the abutment that is not completely bonded? Could we be dealing with an implant itself that's looseness? So this is the strength of InnerView. You combine the mobility reading and you combine that with the NFE data, and you begin to have a much clearer idea of what possibly is happening. It's a very, very intuitive, user-friendly process. It doesn't take that long. We, at this point in time, my staff members can scan a patient start to finish in about 90 seconds. The software then gathers that data. It's uploaded to a cloud-based software program, and then we get back a finished report in about 30 seconds. I think that for the very first time, we have a guide. InnerView provides us that missing piece of information that I think is critical to allow us to elevate not only our diagnostic skills, but also our ability to assess what is the result of what we're doing to teeth restoratively. You have the ability to make informed diagnostic decisions that are not only in the patient's best interest, but in the practice's best interest. Not only is it about money, it's about doing the right thing for the patient. I would say this is a no-brainer. It's the easiest decision in the history of the world, in my impression. After doing dentistry for the length of time I have, this has totally changed my concept of what my focus is when I see a patient. It's totally changed my focus when I see a patient of record, and it verifies whether or not our treatment that we're providing up to this time is adequate or if it's inadequate. If it's inadequate, it gives you an ability to be proactive, to preempt catastrophic events from happening, particularly on those cases where you find yourself all of a sudden half the tooth is gone because there's undiagnosed decay that's where, or there was an undiagnosed fracture line in the tooth. That allows you to head that up and keep you from delaying treatment that will ultimately really benefit the patient, and it will benefit the practice. It's a no-brainer. Just do it.